do state dental boards look at the whole area of Botox and dermal fillers? Well, the truth of the matter is, we're using it for dental aesthetic and dental therapeutic uses. So it's already within the scope of practice of dentistry. Well, you know, because it was so new in dentistry, people really didn't understand what Botox and dermal fillers are. All Botox and dermal fillers are pharmaceutical agents. When you use them within the scope of practice of dentistry, it's dentistry. You don't need any special rules or any special policies because it's just like doing an implant. It's just like putting in a crown. It's like any other part of dentistry as long as you're using it for dental aesthetic and dental therapeutic uses in the oral and maxillofacial areas. And that's pretty much the scope of practice in dentistry. I mean, for example, you can all prescribe antibiotics, but if a patient comes in and says, you know, doc, I've got an infection on my toe, could you prescribe an antibiotic? Well, you as a dental professional can prescribe an antibiotic, but you can't prescribe it for someone's toe. That's out of the scope of practice of dentistry. Same thing with Botox and dermal fillers. There are uses for Botox and dermal fillers all over the body. But you can't treat all over the body. You can treat from here and up. And depending if you're treating, on what we teach in our frontline TMJ courses, is some of the head and neck muscles as you go down the back. We treat trigger point injections for oral facial pain. That's all within the scope of practice of dentistry. Certainly everything right here is within the scope of practice of dentistry, whether it's in the mouth or it's the soft tissue around the mouth. So all of that is within the scope of practice. It just took a while for dentistry as a whole and for state dental boards to get up to speed. They didn't even know what Botox and dermal fillers were. Now they know. Now they know how they're applied for dentistry. We've taught over 7,000 dental professionals already in the whole area of Botox and dermal fillers for dentistry and for dental practice. Certainly we at the American Academy of Facial Aesthetics have been honored to give courses at the annual Academy of General Dentistry meeting. We're giving one at this year's American Dental Association meeting. We've already given some of our courses, whether it's lecture, hands-on, or live patient, at over 50 different dental societies and dental schools across the United States and Canada. So is Botox and dermal fillers part of dentistry? You bet it is, and it's time for you to go ahead and start learning how to integrate these procedures into your practice, and the only way to do it is with an anatomically based course and live patient training. And we give that course over 110 times a year, so you're certainly welcome to attend an American Academy of Facial Aesthetics Botox and dermal fillers course.